Vaccine rates in Missouri are on the decline, which could cause a problem with supplies outweighing demand. Thanks for joining us at 6:30. I'm Deborah Kendrick.
And I'm Lucas Geisler. We're monitoring how this could affect the state's rollout. We're speaking with local healthcare experts about a variety of topics tonight, from vaccine side effects to in-person events held at schools this year. Let's bring in our guests for tonight. We're joined by MU Healthcare Vaccine Co-Chair Dr. Laura Morris and Columbia-Boone County Assistant Director, Health Department Director Scott Clardy. Thank you both for being here tonight. And Dr. Morris, let's go ahead and start with you on this one. Now, local health officials, I should say, still have concerns over the Johnson & Johnson vaccine. We heard a lot about it the last several weeks. I know it's being reviewed for different safety features. Any concerns that you may have had before or even still when it comes to that Johnson & Johnson vaccine?
So that's a great question. And right now that vaccine use is on pause. So it's not being administered in the state or anywhere else in the country right now, while it's under investigation. And our health safety systems and the vaccine adverse event reporting system worked perfectly to identify a safety signal with those very rare cases of severe blood clots. And while that absolutely deserves investigation and rare and serious side effects are always of concern, in general, those are really rare. They're extremely rare. It's a handful of cases, and the vaccine is otherwise been shown to be safe and effective. So right now, everything is on pause, and we'll have to wait and see what recommendations come after the more intense review of the data. But in general, the benefits of that vaccine are absolutely still going to outweigh concerns about rare side effects, even if those are serious side effects that potentially affect a very small number of people. Remember, COVID is serious and affects a lot more people. So that's why the benefits will outweigh the risks.
Sure. Okay, that's good insight there, Dr. Morris. And Scott, Missouri has been seeing a drop in the amount of vaccine doses that are being administered across the state. Would you say supplies are starting to outweigh demand at this point?
In general, absolutely.
Yeah.
We saw the same thing in 2009 with H1N1 vaccine. And so, yes, that's what we're seeing. We're starting to see a bigger supply of vaccine than there are willing arms to put that vaccine into.
I want to kind of go off of now both of these questions here together, looking at the dropping number of shots that we've seen on average, the daily average going down across the state, coupled with, again, you mentioned that halt, Dr. Morris, in using the Johnson & Johnson vaccine in the state of Missouri. Dr. Morris, I don't know if you'd have an opinion on, because you mentioned it is such a small amount of those blood clots that happened that they think happened because of the vaccine. Is it more harmful, do you think, to have stopped using that one shot, that one dose vaccine when you weigh it against the rarity of those serious side effects?
Well, I don't really think that, we had a choice other than to pause, right? And so I'll use the word pause very intentionally because I do think that it gives the authorities the right amount of time to review those data and to make sure that we can know and advise patients exactly what kind of safety profile there is. We give vaccines to otherwise healthy people to help prevent disease, and we really need to be sure of the safety profile and know what we're giving patients. But by all means, this was really, the timing for this was not good in terms of its impact on our trajectory of how we were vaccinating. And we had a lot of momentum, a lot of steam. And unfortunately, something like this, when it comes up, it really does start to maybe make people question or shake the confidence. And there's a lot of misinformation out there still. And some folks are still, maybe mixed up about the safety profile of the other vaccines, and they're not related. And there's no indication of blood clots related to the ones we have plenty of, and that's the Pfizer and the Moderna vaccine.
I want to ask about some of the clinics that both of you have been holding lately. Scott, I'll start with you. Have you been seeing an increase in the amount of vaccine doses that are left over following those clinics, and how are those leftover doses utilized?
Yeah, that's a good question. So we had a mass vaccination clinic on Monday and Tuesday at the Columbia Mall. To give you an idea, with that clinic, we had about 2,300 doses available. We ended up giving out about 500 doses. So yes, we have quite a few doses left over. Because of that, we are not going to be ordering any more vaccine until we are sure that we've got a plan to use all these doses. And the way we're doing that is a couple of things. We can and have redistributed some of that vaccine to other counties who may need it. And so it's being put to use that way. And then also we have gotten some smaller clinics planned, smaller what we call outreach clinics in certain communities that will be planned and allow us to get that vaccine administered before it expires or anything like that. In the meantime, we're keeping it the way we're storing it the way that the manufacturer tells us is the way to store it. And we have every intention of using every bit of it.
Okay, Scott and Dr. Morris, thanks so much for your insights so far. Don't go anywhere. This conversation will continue right after the break. Welcome back. If you're just now joining us, we are speaking with local health experts about the vaccine rollout here in mid-Missouri.
We are joined by MU Healthcare Vaccine Co-Chair Dr. Laura Morris and Columbia-Boone County Assistant Health Department Director Scott Clardy. Thanks both for being here again. And Scott, we'll start this segment here with you.
So far, schools are preparing for graduations from this year. Is the health department working with the districts on these sorts of plans?
Sure. Yeah, schools. We've been working with the schools, for the past year on helping them figure out how to do things safely. And, graduations aren't any different. They are reaching out to us, asking us to review their plans for graduation and, how they want to go about doing things and getting getting our opinion on if there's anything they can improve on or how to do things more safely. So we're happy to consult with them on that, but that's how that works. They reach out to us, provide us their plans, we take a look at them.
Okay. This is more of a behavioral question for you, Scott. Do you know, have schools or any of these districts or maybe any other large groups that want to put on big events with your department's blessing, have they explained why they may feel more comfortable holding these in-person events again?
Lucas, in general, what we're hearing, not only just from schools, but from other places too, are basically it's because the number of new daily cases is down and hospitalizations are down and vaccinations are up. And I think for those three reasons, in general, people are feeling a little bit safer. We're not completely out of the woods yet. I'm sure Dr. Morris would agree with that. We have to still be careful. But certainly we're on the right track. And in general, I think that's what people are looking at.
Sure. And Dr. Morris, is MU planning on doing any sort of campaign or making efforts to help increase the demand for vaccines to get people vaccinated?
Absolutely. We are advertising, broadcasting on social media, doing other types of media spots to really get out there and let folks know you don't need to wait any longer. This is a big contrast to the beginning of our vaccination campaign when everybody wanted a vaccine and there just weren't enough to go around. And the opposite is true now. So, we heard about leftover doses from the health department's event. And at this point, that's just sad. It's there, it's waiting for vaccinations. And so our goal is to make sure that everybody knows vaccination is available. Everybody knows vaccination is safe. And those younger, healthier members of our community, it's their time now to step up and help us finish this out strong.
And Dr. Morris, what do you hear from people what's stopping anyone from doing this right now? Is there any common concern that maybe the calls that come into MU Healthcare or anything like that? What's the holdup you think from people right now?
I think there's a couple of different factors to consider, and one of them might be those positive things that Scott just said. We are seeing lower case numbers and hospitalizations and serious infection rates are down, and we can attribute some of that to vaccination and our success at vaccinating the older, more vulnerable members of our community. So that's great, but that lends a sense of maybe complacency or that slowing of momentum that a lot of the people who were very excited about getting vaccinated felt really strongly about it. Well, they've gotten their shots now. And so it's maybe folks that it hasn't been easy to access, or maybe they have concerns about cost. It's free, and other things like that, that there still are some parts of our community that just haven't quite gotten the message and haven't gotten the motivation to go out and get it done yet.
Okay. And Scott, from your perspective, what conditions need to be met before the health department can lift the health orders?
Yeah. Yeah, that's a great question. That's a question we ask ourselves every day.
I bet.
We're going to be looking at three things. It's the three things I already mentioned. We're going to be keeping an eye on the number of new cases that happen every day. We're going to be keeping an eye on hospitalizations, and we're going to be keeping an eye on how many people get vaccinated. As long as all of those keep going in the right direction, we're headed in the right direction for some easing of the order. But if for any reason one of those would kind of go askew, that would be reason for us to, as Dr. Morris said earlier, to take pause and look at what's happening here. But those are the three things we're going to be looking at and be keeping a close eye on over the next 2 or 3 weeks here.
And really quick, Scott, we have 20 seconds. Is there a certain percentage of the population that you want to see in Boone County get vaccinated? Is there a goal number?
We want to get as many vaccinated as we possibly
Sure.
can. We found out today that Boone County is actually leading the state in the number of people, or in the percentage of citizens who've gotten vaccinated. Boone County has gotten 42.9% of their citizens at least initiating vaccination. They haven't all completed it yet. So that means we're headed in the right direction, but we've still got a lot more work to do with just 42.9% starting.
All right. Scott Clardy, Dr. Laura Morris. Still don't go anywhere. We'll continue this discussion later on in the show.
A magic number that we can kind of settle on to know exactly how many people we need vaccinated. We just know it's more than we have right now.
You mentioned again that number is hard to pin down on herd immunity when it comes to COVID-19 on that percentage. I do want to ask about some of the outreach efforts that are being done to try to get there. Scott Clardy, you mentioned having some smaller clinics, maybe community-based vaccination clinics coming up in the future. Can you go into detail on any of those? What's in store to try to get people sort of in the door and in the seat to get a vaccination?
Yeah, I'd love to. So these are clinics, that we continue to work with our partners at MU Healthcare, Boone Health, and the pharmacies throughout the county that are vaccinating. We're working together to try to come up with some of these outreach clinics. There's going to be one this Saturday at Indian Hills Park. I'm looking at my notes. I want to get the times right. It's from 9 to 11:15. You can make an appointment or you can just walk up. If you're in the area and you want to get vaccinated, help us move forward. Just come on over and we'll take care of you. It's Moderna vaccine, so it's only for those 18 and older. Then we have another one scheduled next Wednesday, the 28th, from 3:30 to 6:30. That's going to be in Centralia at the Centralia Intermediate School. That's going to be completely walk up. Again, it's if you're in the area and you want to help us move forward, come over and get vaccinated. We're also working with Columbia Public Schools to schedule some in there, for their students that are 16 and older. We are in conversations with some of the other communities in the county. Ashland and Harrisburg come to mind right away. So we're continuing to reach out to all those. The schools have been fantastic to work with. We're realizing, and also that we do weekend and evening hours, that helps too. So we're trying to be as accessible as we can to make it as easy for people as possible. And it's free. That's an important thing to remember.
Sure. And Dr. Morris, we've mentioned this before, but people that are still hesitant to get the vaccine, I think one of the biggest things that I hear from people when I ask, why, is they want to wait and see what happens in the long run. I think I hear that the most is we just want to wait and see. And for people that have already gotten vaccinated, what are your thoughts on those long-term impacts for those who are vaccinated? Is there a risk? Is there something, that we all need to be aware of here?
Yeah, I think we know now with the hundreds of millions of doses of these vaccines that have been administered worldwide, we have a really good picture about their safety and their efficacy, and we know that we need to use them to stop this pandemic. And the reality is that the vaccines haven't been in use more than several months, but with all the other vaccines that are on the market and the way that vaccines work in general, we're not concerned about effects that are likely to show up, months or years down the line, right? Even the recent concerns about some safety signals that have been uncovered it's taken millions of doses to show those effects. And they're still very close term, right? Those are things that are happening very soon after vaccine administration. So
Right.
from a medical standpoint, longer term risks are not something to stop you from getting this vaccine.
Okay, good to know.
Dr. Laura Morris, Scott Clardy, thank you both very much for joining us tonight.